Dr. Paul Fadale from University Orthopedics joining us in studio to talk some injuries in the NBA Finals, and none bigger than Kristaps Porzingis. We thought we had him back, came back for 2 games after a calf strain that he was dealing with for a little over a month, and now he suffered a torn medial retinaculum, which is allowing a dislocation of the posterior tibialis tendon. How did I do?
Unbelievable. You're in medical school. This is good.
What does that mean in layman's terms?
Bad. That's
Okay.
exactly what it means. So the right ankle or calf is bad. You say nothing could get worse. It got worse significantly. So apparently on his left side, the tendon that goes down the side near the inner part of your ankle sits in a groove. And the retinaculum is the tissue over the top. Think of it like a carpal tunnel. There's tissue keeping the tendons and the nerve in. That tissue now stretched, may have torn off the bone. Now the tendon is moving. That hurts. And not only does it hurt, the foot mechanics now start to change. So he can't run and jump the way he normally did. What we don't know is how bad is it. It could be just subluxed a little bit, little partial motion, Novocaine it up, or Marcaine it up, get out there, let's see what we do. Or it's really coming out of the groove. They'll shut him down.
So he did continue to play after suffering the injury. Does that give you any indication as to how serious or not serious it might be?
My hope was that it wasn't as bad as it came right out of the groove, because if that's what happened, they would probably just stop him and say you can't play anymore. That's a really rare injury, and for him, it could end a career. They're going to want to fix that. So if it's just sliding a little bit, they might be able to get through that, numb him up, tape him up, rehab him up, and get him out there and fix it at the end of the year if it needs to be fixed. Yeah,
you said could end a career. I mean, that is raising a lot of eyebrows just hearing you say that. So is there any benefit to even putting him out there? I mean, we know that it's the NBA Finals, but he's got medical professionals. Joe Mazzulla said the decision is out of his hands. Obviously, the player's going to want to play, right? But you're in that medical space. What would medical professionals advise him to do?
So he said, I'll go out there and die for the team. Joe said that's not going to happen because we need you for next year. We need this thing to keep going, and it could go from bad to worse. They do not want that to happen. They're going to have to, if it's bad enough, they're going to play around him. As you notice, they got several opinions. So it's clearly not all the way out or really dislocating badly, but it's also not normal. He's in the gray zone, and now someone's going to have to put their reputation on the line to say, let's see where it goes, and mitigate risk versus benefit, which is what we do in locker rooms all the time with athletes. And the farther you get into the playoffs, the farther you get to the end of the season, you start taking risk because you may never get here again.
Yeah, no, you're exactly right. And obviously a lot on the line for the Celtics. He's a huge key part of this team. They get him back from the other leg, which was the calf strain. So the Celtics are saying that they're not related. Do you believe that? Obviously, if they're saying that, there's good reason to say that, but could there be maybe cause and effect, not necessarily related, but maybe he's favoring one side so it causes more pressure on the other side? What's your take on that?
I think you're onto something. I think that's real. These are such rare injuries, but the other side is hurting. So it's 7-3. He's trying to get around there on a leg and a half, so that the injured leg, now the left one, now it's starting to see more pressure that it normally wouldn't see. And he's had so many other injuries. You don't know he's been dealing with this in the past, and he aggravated it further. So I don't think they can just say, yeah, they're not connected at all. I think there is a little bit of connection between the two. There's 2 legs. Now they're both injured.
Yeah. So can he injure both or either of these injuries even more if he does go out there and play, or is that depending on how serious the new injury is?
That's the problem. I will tell my own patients, look, you got 2 legs. We're out of time here. There's no way to protect one to the other. It's not possible. So even if the calf's feeling better, it's not going to be 100%. So he is going to put some strain on the left side. Once again, the question is, if it's not all the way out, can they put some medicine in there and cover him for the couple of hours it takes him to play that game? Or are they afraid that if he does it, it'll tear more? And I don't want to be the guy who's making that choice, which is why there isn't going to be one guy. They have several people, sort of a team physician meeting that they're all going to get together without Kristaps and tell the coach, this is what we think.
And if he does play, what do you think he would look like out on the court? How would it impact his play if he's able to, like you said, get that shot, maybe take some of the pain away and get out there?
It's amazing what maybe the average fan doesn't realize is when you get this deep into the season, the needles unfortunately start coming out and people play with broken bones, dislocated joints. It's really gruesome. You're never going to get here again. And so he may look really fine, even though when the medicine wears off, it may not be so pretty.
And another guy that reportedly got an injection before Game 2 was Luka Doncic, dealing with a thoracic contusion. chest contusion is what I make of that.
Yes.
That type of injury in the game of basketball, how does that impact a player like Luka?
Probably just, again, they're banging out there. So he puts up a block, someone runs into him, his ribs are sore. You can numb those up, and that's very common also in sports where you numb up the rib cage. And then it'll wear off a few hours after the game. He'll be sore, and they'll do it again before the next game. They have to do that to keep him playing. Now, in the middle of the season, you may not do that.
Yeah. So with Kristaps Porzingis, you would imagine that if we were in the middle of the season, back to him, obviously, he maybe wouldn't be playing tomorrow. The whole reason why we're even talking about this, that it's even a conversation, is because it is the NBA Finals. Is that correct?
There's no doubt. If this was the middle of the season, okay, he got hurt again. Let's just settle it down. Al Horford comes in. They work the offense around it. And we're going to wait and see. But there's no more time. We're out of time. And he may never get here again. As these kids realize, they may never see this again in the finals. So they're going to do, as he said, I'll die for this. But the physicians aren't going to allow, Joe won't allow that to happen.
Yeah, and if it is on the more severe end of the spectrum, how would that even impact into next year? Is there a potential that he could miss even into the beginning of next year?
Well, if he has surgery, right, then you got to go through all the recovery, so now it all slows down again. So these decisions can't be isolated, because you're right. You also have to consider what next season's going to look like if we have to operate on this. So, like you said, he was moving around a little bit. That was very positive for me. So this may be on the lower end of an injury, but we're here tonight because we're in the NBA Finals. So everything goes up a level.
Well, and reporters on the ground in Dallas were saying that he didn't seem to be walking with a limp. Is that a good sign?
Oh, tremendous.
Okay.
Tremendous. Again, I think he's on the lower end. You know, that's what everyone's thinking.
Yeah.
That's one you can numb up and get him out there and see how he does. The fear is, if the tissue's weak, it could possibly tear a little bit more, and you go the risk reward with him before the game.
Right. And what are you looking for if he is on the lower end, that so that you can prevent that from happening? Are you looking for something? Is there something you can see, or is it more of a feel thing for him?
You can't run offense plays. It's going to happen. It's going to happen, and everyone's going over the video of the game, like, where did it happen? What did he do? It's just like, these are just freak injuries. So if it happens, it just happens, and you have to say, we knew it could happen.
Right.
Here we are, and we're done.